Hi, I'm Patrick Sorensen, and my topic is on the benefits of watching horror movies. I chose this topic because I found it interesting that despite my love for horror movies, I find it difficult to explain why. Why is it that people like to be afraid? What benefits are gained to make them more appealing? I hope to answer these questions and more through this essay, but first, a little background. The horror genre has been around for a long time now. In fact, the term horror was first used to describe Horace Walpole's 1764 novel, Castle of Otranto, as quoted from an article by Karina Wilson. Still, the genre's roots can be traced back further, evolving heavily off mythology and other questions about the unknown. With recent movies coming out these days, it may be difficult to see how we got to where we are, but even more difficult would be to explain why this genre has been so popular for so many years. I aim to help do this, however, and so I investigated how horror movies affect their viewers to see if there are any benefits to gain. A study from the International Journal of Hematology and Blood Disorders looked at relationships between horror movies and normal blood oxygen levels to help answer this. The article first noted that when experiencing fear, we feel an increase in heartbeat, adrenaline, hormones, and increased intake of oxygen. To compensate with fear, our respiration rate rises, and hence, our blood oxygen level enhances. The study concluded that there was a relationship between horror movies and the blood oxygen level of their viewers. It turns out that people with a higher, more normal blood oxygen level experienced no fear while watching horror movies, compared to people with a lower blood oxygen level, which did experience fear. This is an interesting conclusion because it shows that people who are less afraid of horror movies are arguably healthier. An interesting find, but more research was required. I then continued to determine if these effects of fear were healthy responses or if they instead had a negative impact. An article by Ellen Blum-Barish, an award-winning writer, editor, and writing instructor, compared these responses to similar thrilling experiences such as roller coasters. Barish asked Dr. Lenore Terr, a San Francisco child psychologist, and what she found was that horror movies and roller coasters provide a safe environment to confront our fears and gain mastery over our feelings, as Dr. Terr said. This concludes that horror movies can have a natural, positive effect on people looking to face their fears in a safe and healthy way. That being said, there may be some unforeseen negatives to watching horror movies as well. Taken from an article from the University Association for Research in Fundamental Psychopathology, a study was done on whether horror movies could induce PTSD-like symptoms. The study resulted in 13 cases with horror movie-related distress, 11 of them experiencing psychological reactions ranging from specific phobias to full-blown psychosis. The study concluded that though rare, PTSD-like symptoms could arise in people with past trauma. From these discoveries, further research could be used to determine what the majority of people who enjoy horror movies have in common. It would be interesting to see if the effects on viewers described in this essay correlate with the people who enjoy horror movies. Do people with higher or lower blood oxygen levels enjoy horror movies more? Maybe some trauma could even be relieved if a movie with similar events has the protagonist win. But for now, I would like to conclude that horror movies can have a positive effect on people trying to confront their fears in a healthy way. However, they may not be the best for people who have experienced traumatic events in the past. But with that, I will conclude and I will continue to enjoy horror movies and will leave it up to others to decide what's best for themselves. Thank you.